Today's lecture continues our series on cranial nerves with cranial nerve number 9, the glossopharyngeal nerve. Now, the glossopharyngeal nerve begins on the anterior portion of the medulla oblongata and then continues laterally and through the jugular foramen. Now, the glossopharyngeal nerve has a few different types of fibers. It has special sensory, general sensory, brachiomotor, and parasympathetic fibers to it. It has multiple functions, which will be discussed later, as well as the result of the lesion, which is the gag reflex. Looking at our next diagram, we can see that the glossopharyngeal nerve has a few interesting branches to it. So as we can see here, the glossopharyngeal nerve comes through the jugular foramen, where it is immediately welcomed by two ganglia, which house the sensory nerve fibers. We have the superior and inferior ganglion. I have depicted the sensory nerve fibers in red, motor nerve fibers in orange with the black dots, and parasympathetic fibers with the red dotted lines. So, the glossopharyngeal nerve continues down through the jugular foramen, where it is now an extracranial nerve. Here, the sensory nerve fibers branch out into a pharyngeal branch, a tonsillar branch, and a lingual branch, not to be confused with the lingual nerve. Also, there is another branching called the carotid branch, which goes directly to the carotid body and the carotid sinus. So, we have the pharyngeal branch, which goes to innervate the pharynx and supply sensory to the oropharynx. Glossopharyngeal also comes and innervates the posterior 1/3 of the tongue, both general sensation and taste to the posterior 1/3, and general sensation to the palatine tonsils in the back of our throat. Looking at the orange and dotted motor fibers, the glossopharyngeal nerve innervates only one muscle with motor fibers, and that is the stylopharyngeus muscle, which helps to shorten the oropharynx as well as raise it during the swallowing process. Up here, we can see the parasympathetic fibers continue as the tympanic plexus. Here, they synapse and become the lesser petrosal nerve, which continues along and goes through the foramen ovale, where it meets up with the otic ganglion. At this point, it hops on the auricular temporal branch from cranial nerve number 7, and then innervates parasympathetic fibers to the parotid gland for secretory motor innervation. So, to summarize what I've said over here on the right, we have the general sensory fibers, which supply sensation of the posterior 1/3 of the tongue, the pharynx with the pharyngeal branch, the carotid body and the sinus over here, which helps the carotid body to measure both oxygen consumption as well as blood pressure. And also, we have sensation to the middle ear. In our special sensory, again, the lingual branch will provide taste to the posterior 1/3 of the tongue. The brachiomotor fibers supply the stylopharyngeus muscle to assist in swallowing, as well as our parasympathetic fibers, which innervate secretory motor fibers to the parotid gland for secretion. Returning to this diagram, recall that the result of a lesion of the glossopharyngeal nerve can result in a problem with the gag reflex, even a loss of it. Now, the glossopharyngeal nerve only supplies afferent or sensory innervation to the gag reflex. We'll learn about the efferent fibers in another cranial nerve lecture. So the glossopharyngeal nerve provides sensory innervation to the gag reflex. So a lesion of the glossopharyngeal nerve would result in a loss of the gag reflex. And a physician can simply test this during a physical examination with a tongue depressor to test if your gag reflex is present. And this is cranial nerve number 9.